For the last section of this chapter, we're going to talk about hypertension, a very significant, very common cardiovascular disease. So hypertension is simply a measure of high blood pressure. This goes up with age. There are a whole variety of reasons for that that we won't get into, but in any real detail. But increased sympathetic activation, the stiffening of blood vessels are things that can contribute to hypertension with age. The problem is this causes a increase in the risk for cardiovascular disease, but also can damage kidneys. It can cause rupture of blood vessels in the brain, cause a stroke. So it is a very significant problem. Hypertension can be classified in two different ways, one as essential and other as secondary. Essential, otherwise referred to as primary hypertension, is not wonderfully well understood. There may be a multitude of factors, and we'll discuss a few of those here in just a bit, that contribute to essential or primary hypertension. Secondary hypertension is called secondary because, well, it's secondary to something else, such as kidney disease. So here's what normal blood pressure and hypertensive blood pressures look like. So normal is a systolic under 120 and a diastolic under 80. And of course, you wouldn't do anything to treat that because it's normal. Pre-hypertension is between 120 and 139 on the systolic side and between 80 and 89 on the diastolic side. Typically, this can be corrected just by lifestyle modification, and usually people do not prescribe antihypertensive drugs to treat that. Stage 1 hypertension is systolic pressure above 140 but below 160, or diastolic above 90 and below 100. Now recognize here, they're talking about or here. So a systolic pressure of above 140 or a diastolic above 90. You don't have to have both to consider to have stage 1 hypertension. Again, here lifestyle modifications may be adequate, but typically hypertensive drugs are now considered to be used to treat this. Stage 2 type hypertension is a systolic above 160 or a diastolic above 100. This is starting to get quite dangerous. And certainly lifestyle modifications are called for here, but virtually everybody with blood pressures in this range are going to be on some sort of hypertensive drug to help to modify that. So secondary hypertension is because, well, it's secondary to something else. And these can include things like some sort of renal disease that results, for example, in inability to produce enough urine, so more of the liquid stays in the blood and the blood volume goes up, or secretion of vasoactive substances like renin, which results then in conversion of angiotensin 1 into angiotensin 2. And as I mentioned, angiotensin 2 is a powerful vasoconstrictor. You can have endocrine kinds of functions, so excess catecholamines from the adrenal medulla. Of course, this is going to increase heart rate, cardiac output, going to increase vasoconstriction, and so going to raise blood pressure. Excess aldosterone, we'll get into this more when we get into renal, but if you remember, we mentioned this a little bit before, aldosterone is going to bring salt back into the blood from the filtrate in the kidneys. It's going to bring water along with it, so it's going to raise blood volume, and as a consequence, that'll raise blood pressure. Nervous system damage that alters the function of the vasomotor or the cardiac control centers in the medulla can increase heart rate, cardiac output, cause increases in sympathetic activation and total peripheral resistance. So all of those can contribute. And then cardiovascular directly. So heart block, these are the AV node blocks that we were talking about. Having pathways via the septa defects are, for example, are things that can do this. These can do things like cause changes in stroke volume, cause changes in the distensibility, the flexibility of the aorta, stiffening of the arteries. So these can raise blood pressure as well. So in this table, I'm not going to expect you to know all the details here of the examples and the mechanisms as much as knowing that the kinds of systems that can contribute, kidneys, endocrine, nervous, and cardiovascular, are all possible secondary causes of hypertension. Now, essential, more people fall into this category than secondary. And the problem is it's not very easy to understand exactly what is the underlying cause. Salt intake, taking too much salt. Again, in Western society, we eat way too much salt. But normal, healthy individuals typically can handle that and get rid of it. Other people are very sensitive. to increase in salt, and it results in an increased blood volume. Part of this may be also a reflection of the inability of the kidney to get rid of that excess salt, and as a consequence, then urine volume doesn't go up as much as it should, and the liquid stays in the blood instead and raises blood volume and blood pressure. We'll talk a little bit more about these renal aspects here in the last chapter of the course. Anything that's going to increase sympathetic nerve system activity, this is going to increase heart rate, stroke volume, cardiac output, increase peripheral resistance, so all of those things. And those can be anything from drugs, for example, including drugs of abuse like cocaine or methamphetamine derivatives, will increase the sympathetic activation, or even stress. Things like PTSD or emotional stress can elevate sympathetic activity and cause increase then in blood pressure as a consequence. Paracrine regulators that influence the blood vessels themselves, regulators from the endothelium. We talked about one that's a very powerful vasoconstrictor called endothelin, or reductions in ones that can cause vasal relaxation, smooth muscle relaxation and vasodilation, like nitric oxide. So loss of that can also enhance then vasoconstriction and raise blood pressure. And so any of these things that can increase total peripheral resistance then is going to cause an increase in blood pressure and our potential underlying causes of essential hypertension. So the problem with hypertension, whether it be essential or secondary, is damage to organs, particularly ones that are really quite sensitive to increases in blood pressure. So blood vessels in the brain, of course, are quite sensitive to blood pressure and are why they're so exquisitely regulated. And that blood flow is maintained very close to 750 mils a minute, as we discussed a little bit earlier. But you don't want those to rupture with blood vessels causing what's called a hemorrhagic stroke. Also, if you increase the blood pressure, this increases afterload. That is, there's more pressure holding the semilunar valves shut. And so the ventricles have to do a lot more work to raise the pressure inside the ventricle to above the pressure on the other side of the semilunar valves to allow those valves to open. And this then can produce something called hypertrophy. This is the enlargement of the ventricles. We're not going to talk about that here, and you will discuss that for those of you who are going to go on to a higher level of analysis of this. There's a mathematical and physical analysis called the law of Laplace, and this is a description of how the radius of a vessel is influenced by the pressure it needs to rise based on that diameter, that radius of that vessel. In this case, the radius we're discussing here is the size of the ventricles. And so as ventricles increase in their size, they have to work a lot harder than to develop the same amount of tension to raise the pressure to open those valves, and this causes them to work too much. This can cause damage to the heart muscle, result in arrhythmias, and then even eventually to cardiac arrest and death. Also, this elevation of blood pressure in the vessels can damage the vessels, and if you damage the vessels, this can lead to inflammation. This can cause then the attraction of white blood cells, macrophages, to engulf cholesterol and become foam cells, and then lead to atherosclerosis as well, and contribute another way then to cardiovascular disease because of this hypertension. So treatments. Well, lifestyle modification is a big one. So limit how much salt we take in. As I mentioned, we eat tremendous amounts of salt, particularly people who are eating prepared foods or eating fast foods eat huge amounts of salt. And so if you're salt sensitive particularly, you need to find a way to reduce that, make your own food with a lot less salt in it. Smoking cigarettes is not good for it. Excessive alcohol is not good. As well. Losing weight has a big impact, and getting enough exercise, particularly aerobic exercise, can do a lot to drop your blood pressure. Potassium and potentially calcium supplements or enhancement in the diet. There's some evidence to suggest that these can help. Diuretics, this is a drug treatment, which what that means by diuretic is it increases the amount of urine that's being produced. And if you increase urine volume, you reduce blood volume. If you reduce blood volume, you reduce blood pressure. Beta blockers. Beta blockers are beta adrenergic receptor blockers is what that means. And so what you're trying to do is inhibit the ability of the sympathetic nervous system then to activate the beta blockers and therefore increase blood pressure through an increase in cardiovascular in cardiac output. And so beta blockers then decreases heart rate, for example, and this helps to drop blood pressure. Also, I mentioned that angiotensin 2 is a powerful vasoconstrictor, so there are a couple of different ways of inhibiting those pathways. One is inhibiting angiotensin converting enzyme. So this is the enzyme that converts angiotensin 1 into angiotensin 2. This is a pharmacological treatment to help to drop the amount of angiotensin 2 that's being produced. And then ones that work directly on the receptors that angiotensin 2 binds to is now another very common way of doing this. So they have drugs that can do that are angiotensin 2 receptor blockers and inhibit then the vasoconstricting effects of angiotensin 2. So these are another common clinical pharmacological approach then to treating hypertension. So here's a list of all these things. There are diuretics and things that have to do with the sympathetic nervous system and vasodilators and calcium channel blockers and ones that have to do with angiotensin. I'm just going to leave this table in here for your reference. I'm not going to quiz you on those sorts of details. I'm going to leave this in because certainly for those of you who are going to go on to the next level, you're going to be using this information then to be treating your patients with hypertension. So this I'm leaving in there, but I'm not going to quiz you on that. You do need to know what hypertension is. You need to know what the blood pressure values are for being hypertensive. You need to know the difference between essential and secondary and the potential causes for that, but not these particular details in this table here for treatments.